The much dreaded second wave of COVID is here. At the time of this recording on 2nd April, India reported over 80,000 cases in a span of 24 hours. This is the highest single day peak in the last 6 months. Karnataka has reported nearly 5,000 cases, with more than 3,500 cases being reported from Bengaluru alone. The state is just behind Maharashtra in the number of active cases. In Bengaluru, pubs and educational institutions have been identified as clusters and some have been turned into containment zones. I'm Suraksha, and in this week's Coping with Coronavirus, we will look at how the second wave is different from the first wave and the challenges we may face.
There is high chance that the virus is changing and probably more infectious, but we simply do not have the evidence yet. There is a probability of that some proportion of these rise in cases is because of reinfections, but we simply do not know it, especially if people were asymptomatic in the first time and now they're getting infected again. We simply don't know. The second thing is that in terms of waning antibodies, even if there are infections in the earlier wave, have the antibodies disappeared, and is it the reason why it is occurring again?
Compared to the same time last year, the fear around COVID-19 has dropped dramatically. Election rallies and other large congregations like festivals following little to no COVID protocols may make the second wave far more dangerous to contain. Reacting to the rise in cases, the Karnataka government has cancelled physical classes for students in class 6 to class 9 just a month after they were reopened. In Bengaluru alone, more than 470 children below the age of 10 have been infected with the virus since March 1st. Karnataka has banned parties in apartment complexes and has also banned protests, rallies and strikes of any kind. The closing of gyms and swimming pools will continue. Cinema halls, pubs, clubs, bars and restaurants are to function at 50% seating capacity. These restrictions are in effect till April 20th. If any violations are found, restaurants and other watering holes will be closed till the COVID pandemic is over. Travel restrictions are also back. Travellers from Maharashtra, Kerala, Punjab and Chandigarh have to present a negative RT-PCR report before entering the state. The reports should not be older than 72 hours. The BBMP is gearing up for the increase in numbers and has instructed private hospitals to keep 10% of their beds aside for government quota COVID patients. The Central Health Ministry has also instructed BBMP to ensure contact tracing of at least 30 people for every COVID positive patient. The BBMP is back to syndromic approach of testing. That is, only those who show COVID-19 symptoms will be tested. This is to prevent the wastage of testing kits. However, for those who are asymptomatic, COVID-19 tests will continue to be available at private testing centers across Bengaluru.
To do syndromic approach, you have to identify almost as much as possible all cases of ILI, influenza-like illness, and not to miss even one case of SARI, severe acute respiratory infection. You don't know where these cases are. Unless there is proactive system which seeks out these cases, tests them, you can simply say probably that no, we don't have many ILIs or many SARIs. So syndromic approach will still continue as the mainstay of identifying clusters and preventing deaths and ensuring that people get the kind of support in terms of treatment when they require.
The positivity rate of symptomatic individuals is 2.7%, while that of asymptomatic individuals is at 0.8% as of March 27th. So to arrest the infection quickly, a syndromic approach is believed to be ideal. On the vaccination front, India has stopped exporting its vaccines to foreign countries in order to expand the drive to its own population first. The third phase of vaccination is underway and the criteria has been expanded. Those over the age of 45 are now eligible to get the vaccine. As the cases surge, many younger people are demanding for further expansion of the vaccination drive.
Aspirational is any person above 18 years should be able to get the vaccine. But in terms of what is practical, if you look at the kind of pace of vaccination which is happening now, I'm not really sure that opening up all the age groups will suddenly change everything. The reason is we need to balance both demand and supply. Once the supply is ensured that there is enough vaccine, and there is also differential aspects of supply where people who can afford can buy, and there is also a choice given to them. So if the government is the sole provider and assurer of vaccines for all the people below the poverty line and those who cannot afford the vaccines, and then you open up for everyone else, then it will be an equitable way of addressing vaccine issues.
The Karnataka government has so far ruled out the possibility of a lockdown. However, after a year of restrictions, it is up to all of us to ensure the second wave doesn't spiral out of control. That's all from us this week. Next week, we will be back with a new episode of Coping with Coronavirus. Until then, stay safe.